Hi, and welcome back to the Andean Medical Mission's Beyond 2020 series. Happy New Year to you. It's been a little while since I've made my last video, and just been really crazy busy with trip planning and team building and funding. But I thought I would give you a little tour of where I live and talk about the benefits or the advantages of living in Bolivia versus the advantages of living in the UK from the point of view of running a charity. So the Andean Medical Mission has been going for 12 years now. 6 of those years we ran from the UK, bringing teams into Bolivia, but organizing and running everything from the UK. And the last 6 years we've been running everything from Bolivia, again bringing teams in from the UK, but organizing everything from here. And today I thought I'd talk to you about what are the advantages, what are the disadvantages of each of those two systems. So let's talk about that. I made a little list of advantages of living in the UK with regards to running a charity and living in Bolivia running the same charity. And there's advantages for both. So obviously one of the big advantages in the UK is the access that you have to discuss the project with people who potentially can support you. So there's a whole ton of ophthalmologists that you can go and talk to. There are meetings you can attend. There's a whole load of talks that you can do to groups that are socially responsible and would be interested in potentially funding you. There's a whole lot of opportunity to promote your charity when you live in the UK or in the States or in a modern or more modern country. In Bolivia we can do talks, but you know, if I do a talk here, I might get £1 or £2's donation from each person, as opposed to in the UK, where a good talk and you could walk away with £500 to £1,000 very easily in just one evening, with a whole load of people who would support you and commit to raising funds for you and having teas and making regular payments monthly as well. All of that existed when you're in the UK, and so there's a real advantage to running a charity and running the funding of the charity from somewhere like the UK, where you have a base of people that will support you. In terms of friends, that was a big concern for me. Leaving the UK, I had a base of friends there that obviously I'm not going to see very often. I have family as well in the UK, although my family is quite spread out. I have a son in Australia, one in Scotland currently, but he spent quite a lot of time in Canada as well. And my father, who lives down south of England, and my sisters are there. So obviously that was a concern, leaving and not really knowing anyone in Bolivia. But it's worked out really well, and I've made some great friends here, people who sort of neighbours I suppose, but have become friends over time, and we regularly have coffees and drinks around each other's houses. And so that's been a real positive and very pleasant surprise, that it wasn't as difficult as I thought to make friends moving to Bolivia. Just having control over things like medicines and consumables, what you pay for things. You know, we know that we paid high prices for many years here, and we managed to get mostly what we wanted, but there were times where I brought a whole team of people across from the UK. We get here, everything is ready, except there's no viscoelastics, or except the lenses in 21 to 23, they didn't have any, but they've got loads of 16s and things like that. You're just having control of your equipment, being able to test it before your main team arrives, being able to actually go and check out the hospital before your main team arrives, so you can get it clean. You can have changes made. This year or last year in Magdalena, I had all the lights taken out. They had in their operating theatre these really old strip lights, and they just needed all removing, and because the risk of, well, they were just filthy, and it wasn't a suitable environment to operate in. And so having the time by being here, being able to transport all of the equipment safely in your own vehicle is also a huge plus here. I can drive slowly. I'm not trusting a truck driver who may be in a terrible hurry to race on these bumpy, muddy roads through Bolivia with all our equipment bouncing around in the back and potentially getting broken and damaged. You know, I can put everything in my truck or in the Andean Medical Mission truck and get it there slowly but safely. I also only need to take just what we need. So if we're doing 50 operations, I just need to take 50 of everything, and it's much better in terms of we're not carting around boxes and boxes of stuff that we don't even know what's in it. But because we're on a rush flying from the UK, getting here, sticking everything in an aeroplane or on a truck, getting to the village and then unpacking and finding what have we got, what's missing, what did the last team lose or break, that you only used to find out about when you got here. And all of that has changed. We are really efficient in terms of setting up our operating theatres, in terms of having the right things, having everything working. So that has been an amazing plus, an advantage of moving to Bolivia. There's another huge advantage as well which goes with that, and that is the time that you can spend after your surgeons have gone, making sure that everybody is well, everybody is doing fine before you leave the town completely. So normally we work sort of Mondays to Fridays, I suppose. We work Saturday mornings sometimes as well. So Friday, when the surgical team has gone, that used to be it. You know, we always used to get on an aeroplane on the Saturday from Santa Cruz back to the UK, and you would worry about your patients. Are they all right? And you hoped they were, and maybe you didn't operate on anything Wednesday and Thursday, maybe just pterygium or skin tumours, which you probably didn't do intraocular surgery on the last days. Well, now we can, because I stay and I can follow all of these patients up. Friday, after the plane has taken the team out, I will see everybody. The following Monday, I'll see everybody and start discharging everyone who I think is good, their vision's good, their pressure's normal, they've got plenty of drops. Then I can start letting people go home, and I stay until everybody is fine. But even then, I come back a month later, or in the last trip, I'm unfortunately with road blockages and things that were taking place in Bolivia, it was nearly 2 months that it took me to get back. And even then, I found some people that still needed some help. I can bring in assistance, and there are people in Santa Cruz and in La Paz who would gladly help us with our patients should we need them, if an infection or something were to occur with any of our patients. What else? Cost of living. Cost of living is a big difference. The house that I live in cost me very little. I don't have a mortgage anymore. I was able to sell my little house in England, pay off my mortgage. I bought a second house in a slightly less expensive part of England, which I rent out, and that gives me something to live on while I'm in Bolivia. And with what I had left, I bought the house that we live in, and it's lovely. It's a very basic house, and it's not particularly luxurious, but it has a very nice garden, and it's in a beautiful part of Bolivia. So I enjoy very much living here, and I can go out and get a steak dinner for £1 in parts of Bolivia. £1.50 will give you a great lunch of soup and a main course and a drink to go with it. And they're even serving salads with food now in Bolivia, which a few years ago just was unheard of. So you can get a decent meal. Electricity probably costs us £20 a month. Water is £10 a month, something like that. And we don't have any heating costs at all, although we do pay a little bit to keep the house cool. But cost of living is a massive advantage, and that puts it makes everything more sustainable. The savings that you have go further if you have a property rented in the UK, or you have a small salary as a charity employee, then everything goes further by living here. So that's a plus, an advantage of being in Bolivia. Also, funding. Funding is an interesting point, really, because we have had less funding as a result of coming to Bolivia, partly because we're less able to do talks, and so all I used to do probably 50 to 70 talks a year to Rotaries, Lions, Women's Institutes, various different hospital teaching events, and we were able to raise funds from those talks, and so we've lost that element by me being here. We do have very willing directors who have offered to go out and do some talks, but it's difficult because they have full-time jobs, and a lot of their days are very long and very full, so it's not that easy for someone to drop a surgical list to go and do a lunchtime talk with a small group somewhere in the south of England. So we've lost that side of things, but by being in Bolivia, it has opened up funding opportunities for us to deliver a lot more complex projects. So during COVID, I was out, we were out vaccinating, basically, looking at all the towns that were really difficult to reach and making sure that vaccines got there. And the Ministry for Health and the British Embassy in La Paz were massively helpful in us being able to, organising for us to be able to go out and do that. And the Ministry for Health for Bolivia gave us all the nurses, gave us all the vaccines for free, and we put together a plan which delivered 4,000 vaccines out to people in very, very remote communities. So that has been good, and then allied to that, we discovered that there are many, many towns in Bolivia that the children have not been vaccinated against polio, they've not been vaccinated against measles or rubella. So again, we've been able to go out and do a bit of that. I've got at the moment plans to build a glaucoma service for Bolivia. We have a little bit of funding to do it, and we need to do some screening, and that's going to be very time consuming. So we're trying to focus on people over 60, particularly if they have a family relative who went blind from glaucoma or was definitely diagnosed as having glaucoma. And we have no visual fields machine, but we will be doing pressures, and we'll be doing a dilated disc examination to try and pick up as many cases as we can. Now that, again, that's 3 or 4 months of actually being in the field. And we could never have done that, or thought to have done that successfully. We maybe could have done a town or a village, but we couldn't do a whole geography like we can do now. So being in Bolivia has opened up funding opportunities for things like looking for children with amblyopia. It's another project that we have on the go at the moment. And those types of projects which are preventing people from going blind are very, very necessary in countries like Bolivia, where there is literally nothing like that to support people. And by being here, you can organize so much better, and you can actually deliver projects yourself. Does that make sense? You can deliver the projects yourself, and because you have the time and means to actually do that. So living here has opened up funding opportunities for us, and it has also closed some funding opportunities for us as well. So mixed feelings on that, but overall good. Overall good, I think. Equipment, again, I've just a note on it, just storage of equipment. Again, we have a safe place to store it. We can keep our medicines at the right temperatures. If we have a surplus after a trip, then, as long as they're kept in a fridge, they're kept somewhere safe, they're kept at the right temperature, we can use those on the subsequent trip if it's only a few months away and everything's still in date. So storing of our equipment in a mold-free, fungus-free environment is something that we can do here by living here. And previous to that, it was, I had all of our equipment at parents-in-law's house for a while, and that didn't work. So I gave it to a guy who sells equipment here. That didn't work very well at all. being here has been the best option in terms of looking after the equipment that you have. And we have, well, I don't know, $50,000 to $100,000 worth of equipment that needs to be looked after. So that's a plus of living here for sure. Andean Medical Mission run a helpline. So we've trained over 100 village doctors to manage eye emergencies, and we get weekly, sometimes daily calls from that, and that works really well by being in country. Just as much as anything, just the timelines are the same. If the project would still work if we were running a helpline from the UK using WhatsApp, but you know, there's a 4 to 5 hour difference between the two countries, and so there would be occasions where an urgent case would come in, and you know, in the UK we'd be asleep, and it wouldn't be as workable as it is here. So the fact that I'm awake, normal and alert, normal hours to fit in with the likely times that a patient would present to a health centre in Bolivia is very helpful. And then that doctor can ring me with the patient directly in front of them. I can answer what I can, and where I need the help of a consultant ophthalmologist, then I can ring any one of our medical directors, and if it's at the right time of day, I can normally get a diagnosis and a treatment plan within half an hour, 30 minutes, something like that. So that's been a real plus, and I think we've saved a lot of people from going blind just by having the right diagnosis. And obviously, as I travel around, I'm delivering as many medicines as we can here. That's another plus that's not even on my list. We've organized with the La Paz Ophthalmology Society to collect medical samples. So as the medical reps go around delivering, you know, steroids and dry eye drops and antibiotics and antifungals and things like that, the ophthalmologists in La Paz collect them and they send them to me. And I then take those out when I'm traveling. I drop them off in the villages that need them, and that has been a real plus, a real advantage of supporting the 24-hour helpline that we run. By making sure that we can give a diagnosis and that the clinics themselves actually have the medicines that they need to treat the problem. Even if it's just preparing the patient for travel to see an ophthalmologist, if it's something that can't be managed in the community, then just having some basic antibiotics, having some antifungals, some lidocaine, that you know, if you have a penetrating eye injury, you kind of want to stop your patient from rubbing or touching the eye. Well, having some lidocaine drops is very useful in making sure that when your patient does eventually get in front of an ophthalmologist, that they haven't done too much damage to the eye by touching it or rubbing it or squeezing too hard. So that's been another plus. So I guess overall, I loved living in England and I love living here, and there are advantages and disadvantages to each of those settings. I would say we are more efficient and we do a better job living in the country here. We're probably down a little on finances by coming here, but overall I think the most important thing for us is to do a good job, to deliver programs that prevent blindness, and when we have blindness, be able to intervene safely and efficiently and get really good results. So that's my take on it. What do you think? How do you feel? If you're running a charity, do you think it's best to have someone on site, or do you think it can be done from the comforts of home? Let me know in the comments, and if you've liked today's video, please just click the like and subscribe. And that way, that really helps us to grow our little channel, and it also keeps you informed, so that next time we produce a video, you can watch that as well. So thank you.